Tania, thank you so much for that. That was a really lovely presentation. There are going to be some questions for you. I'd
Okay.
like to ask one. You're a psychologist and you've
Mm.
been trained as a psychologist. When you uh, swap into your medium mode, how do you do it? And do you do it in front of the patient? Do you say we're now going to sit quietly, or is it just something which comes to you? How do you do it?
It's that part of me. I see it as more for myself as a complement of the theoretical knowledge about psychology, etc. So I would, for example, if I'm seeing someone, and I've had several cases where people uh, have been diagnosed with schizophrenia, for example, but I know I've identified quite early on that it's the spiritual companions that are tormenting them, the visions, etc. So I prepare myself extra before the session. I might even pray in the room to create an environment that is conductive and to try and protect that person so that when I talk to them, I'm talking to them and not to the interfering entities. I never use that word with a patient like mediumship or being a medium. I get a lot of intuition, but I don't open up too much because I don't want I don't want interference. The inspiration from the benefactors, the spiritual guides, that comes naturally at the time of need. So trusting that makes me a good area to pick up that information without having to force that issue.
Thank you. That is a very nice answer. I just wanted to extend the question one more, then we'll go on to the ones on the screen. When I was in St. Paulo, I went to a medium session and people were sitting in rows,
Mm.
and there was a medium at each end of the row, and they walked along and put their hands above people. Um, and when that had been done, there's a little talk, and then people went away. And of course, it was quite free. What's your view of using mediums that way?
I think it depends of the context. Within the clinical context, for example, unless the person is open to that kind of thing and introduces that desire to be part of something like that, I wouldn't necessarily open up to that. But what I do a lot as a medium, as a healer myself within spiritist centers, during this, I do like small, short mindfulness practices with people. And one of the ones that I do quite a lot is what I call the shower of light, where I take them through that shower of light, washing away the negativity, replacing it with positivity. And that time, I'm also giving healing to the person, but I'm just not using those words and I'm not putting them in a difficult position to either agree or disagree with my spiritual beliefs because they can get the energy, the positive energy, whether they want to know more about spiritism or not. It doesn't matter. It's irrelevant. The purpose there is to help that individual.
Excellent. Thanks very much. That's a very nice answer. Now, we had the question for you, which was on the screen. There we are. Can mediumnity, can the medium be hidden behind the manic psychosis? Interesting question. Mania and mediumship?
Mania and mediumship, absolutely. In fact, most mental health disorders are mixed. We could call them, there's a dual diagnosis there. There's always a spiritual aspect as well. In the same way, that it goes for the positive side as well. When we talk about inspiration, I had this moment of inspiration, we know that often the inspiration comes from our benefactors that are either enhancing our own natural abilities or even using us as a channel to their thoughts and ideas, knowledge. So it it often is the case. It's about, my view, it's about treating the mind the spirit with positive influences, positive thoughts, positive action, but also treating the body if that has become disturbed as well. If there is hormonal imbalances, chemical imbalances, other illnesses that are affecting that process. So again, it's working in combination with traditional medicine, science, and other therapies.
Yes, I think that's important. For example, would you give somebody in a manic psychosis some of the antipsychotic drugs to calm them down? Or do you feel behavioral means or mediumistic treating is enough?
I think whenever possible, because those drugs are so strong, it impacts so heavily on that person's ability to be themselves a lot of the times. I'm not against it. I don't prescribe myself, but I see a lot of people who are under this type of medication. When properly dosed, it's beneficial because it at least helps the person to cope with the more extreme presentations of their mental spiritual illness, but that alone is not going to be a solution. So they need to change the way they think and feel and react to events around them as well. So that's when, if they are open to it, prayer, healing, meditation would be helpful.
Yes. Okay, thank you. Now we have another question. How to support someone who's struggling with mediumship and do not accept it? It's a nice question.
That goes for the majority of humanity.
Exactly.
With kindness, we cannot force people to believe the way we believe. And if they don't believe, it can work. It can make matters worse by driving them away from the help that they could be receiving. If they don't think that their mental emotional difficulties are at least compounded by external factors, external entities, then they are not going to want to hear us. It's the same way. I work with lots of people who are in abusive relationships in this world. They are married to them, they have children with them. And if they're not ready to move on, if they're not ready to disconnect themselves, telling them how bad that partner is going to drive them away. So the job is to encourage them to engage in more positive, healthier activities. So be careful with watching on TV, pay attention to the music you listen to, the conversations you have, and start from those basic levels.
Yes, thank you for that. It raises another question. Alan Sanderson has done a lot of spirit release work in this country. And one of his lectures I went to, he was saying that sometimes if people are in very traumatic situations, a spirit may get into them and control their behavior. What's your view on that?
We have the key to the door. We leave the key on the door, on the lock, and sometimes we open the door. It goes both ways again. Just blame an external entity is the same as blaming another child or your partner for making you do bad things. At the end of the day, we have a choice. And sometimes the control that certain entities have even take over the physical body of that medium is quite extreme. And again, but if we just say, oh, it is because someone else is making you do those things, then we disempower that individual. We are telling them, you have no choice, you have no control. And if you don't have control or choice, you don't have hope that things can get better, because you have to trust on somebody else to change, and that may not happen. So again, it starts from the beginning, starting from scratch and helping the person to gradually strengthen their willpower, become more aware of the choices they make, become more aware of when they have choices that they can themselves make, and patience a lot of the times from both sides, because these are long-term processes that may not have a resolution in this lifetime. So again, it's offering that person some hope that things will get better, and learning to enjoy and notice the good times, the moments when they are free from their interference, and learn again to enjoy those moments of freedom.
That's very helpful. Let me just take you to one more point, and that is that what Alan Sanderson does is people will lie on a bed and he relaxes them, and then he will talk to the spirit and ask it to come out. What's your view of that?
First of all, they don't come out of anything because they don't go into anything. The connection between spiritual entities and us is from perispirit to perispirits, from mind to mind. So they don't invade our physical body. We become puppets, like, the puppets that you move around, because the connections are there. So the second is that can be a very useful technique, because if you talk, now we don't have a mediumship group in Sheffield, but we did in the past, and I was the main counselor at the time. So that was my job, to talk to those entities and persuade them to move on, to be better. And the way I did that was not by telling them, you are a horrible creature, you deserve punishment, and this poor person, look what we are doing to this poor person, was to say, look, you are harming yourself by doing what you're doing. If you don't like this person, why don't you go and hang out with people you do like, with people who love you, who cares about you? So again, treating that entity as my patient at that time, and helping them to see that there was another alternative, that doing what they were doing harm to themselves as well as that other person.
Yes,
but it
that's
can
really
be a useful
interesting.
technique.
One of the things which Alan Sanderson used to do is to tell the spirit to go to the light. Would that be?
Yes, because the light represents goodness. Often in the light, the light is created by the friends and family that come to try and help them. So that is a very useful technique to use, opening up their minds, to taking them to what was the last time that you remember being with someone you loved? Who was that person? That in itself brings the light to them. And feel enveloped. I also say you're being enveloped by light, because sometimes they are blind, they can't see it, but I know they're being enveloped by light. So that it's about telling the story, as you were saying earlier on. You start creating that mental picture that helps them to see what is there, but they were not seeing before.
Okay, thank you. Now there's another question for you. What advice would you give to spiritus health professionals that try to completely separate the two worlds, psychical and spiritual?
Good luck with that, because I don't think that is possible. You can't. We are body and spirit. We are living in a physical world, but completely intermingled with the spiritual dimension. I would say that respect and accept who you are. I think there is a misunderstanding sometimes that people think I'm a medium, so I have to always express my mediumship. That there are many different ways to express one's mediumship, and if that becomes a source of conflict in terms of trying to help someone else within our clinical practices, then rein in your mediumship and be more a human being, a kind, loving human being, respectful human being. That's more important. But it is not completely possible to separate the two. There is I think sometimes what people think is that if I come out as a spiritist or a medium in my workplace, I'm going to be ostracized. I'm going to be laughed at. I made the choice from the beginning. When I came to Sheffield, I came to do a PhD, and I told my supervisor, I need an afternoon off to go to London every week. And said, why? I said, because I work in a mediumship group and I want to continue. Bang in the middle of the week. Yes, bang in the middle of the week. I'll make out the hours another time. And I had to work harder. But because I was honest and I was not afraid to be who I was, I didn't have to explain. He was not interested in what I did. The only thing he knew is that it was very important to me. And he respected that. This week I had to put in another form at work. I work for the NHS, and we are going back to late clinics, face-to-face clinics again. So they are changing the time, my working hours, and of course it's going to be on the day that we have our meetings. So first thing I did, I went into the website, I pulled in the procedures, I filled in the form, and I said, I need an hour. I need to leave an hour early on a Thursday because of my spiritist meeting. I used the words. And there is a lot more, as you said again, there's a lot more understanding and respect for people's beliefs. And if I find that if by being true to myself and honest, but not pushing, not forcing anyone to believe in the way I believe, I've always been respected. I never had any major issues. I'm not afraid or embarrassed of who I am and the faith I practice.
I think that's an amazing change which has happened, that now it can be tolerated. I can just see that when I was a young medical student, or even in my first years as a doctor, and I'd said that sort of thing, yep, that would have been it.
Yeah.
Okay, there's another question for you. How can we be aware? This is a good one. How can we be aware if there's an entity around us trying to influence us? Apart from people, of course.
There's always entities around us trying to influence us. Some are trying to influence us to do good, to be good, to think good. Some are trying to influence us to be who we were once upon a time, but we are not anymore. Again, the choice is ours. Sometimes I notice, for example, there's something, I'm feeling down, I'm feeling anguished, depressed. And I have a little checklist in my head that I go through to find out whether there is something in my life, my personal life, that justifies that. Have I had any issues at work? Did I have a good night's sleep or not? If the checklist goes no, then I think, okay, there might be someone that is making me feel this way. So I say a prayer, I ask my benefactors for protection. Spiritism instructs us not to talk directly to the troubled spirits that might be around us, but ask our benefactors to help them, to do whatever they need. Outside the mediumship meeting context, we are not encouraged to talk directly to entities, but we can say prayers to them, we can envelop them with love. That's what we do. And if it becomes too disturbing, then we need to get others to help us. If we are in contact with a spiritist center, let the director, let our friends know that we are going through a difficult phase, ask for prayers. Even if we are not spiritists, we can always ask friends and family and say, I'm having some issues. Can you just keep an eye on me, be loving, let's do something fun to lift our mood and our spiritual energy.
And when you walk down the street, do you see spirits around people? Can you do that, or is that a special gift?
Yeah, I don't have that kind of mediumship. I don't hear or see spirits directly. Sometimes I get what I say, I see it in my head, kind of thing. But it's more intuition than vision or than sight or hearing.
Yes. Okay. We had another question for you. First question is related to the possibility to adapt behaviorism principles as Divaldo. Pierre said to repel thoughts, but knowing mistakes from before are repaired through expiation pain. Oh, that's interesting. What do you make of that?
Spiritism says that we can learn through pain or through love. And whenever possible, we should choose love. So we choose goodness. The other aspect of this concept is, yes, as I mentioned in my presentation, if I have engaged in a certain problematic behavior for many lives, and then at some point I made the decision to change, I'm not going to change it overnight. It's not just making the decision to change that's going to change it. So God utilizes with us a system similar to exposure therapy to cure phobias. So God provides us with a string of opportunities to face events that would lead us to behave in the way we behaved before, but this time I'm choosing a different behavior, and sometimes we get it right and sometimes we get it wrong. But we know that when we get it wrong, God will provide us with another opportunity and gradually intensify those experiences until we pass the test and we've learned the lesson. We don't have to go through that anymore. But we don't have to do that through pain. Pain comes from our resistance to change, and we keep making the same mistakes. So I work with people with alcohol who drinks too much, and sometimes I have the conversation. I tell them, go sit in the waiting room for 15 minutes after we finish here and look at your future, or what your future could look like, especially if it's someone who comes in for the first time. Their liver is okay, the pancreas is okay, but I can see what's going to happen in a few years' time if they don't change. And I know that there will be people sitting in the waiting room who are there, whose liver is failing, whose pancreas is failing, they're shaking non-stop anymore. So I say, go and have a look. And then you decide what is that you want to do. You make the effort to change now, or risk being there in a few years' time. So we can use behavioral techniques to change our spiritual history, but it takes time.
Okay, that raises the next question, really, is do you see this planet as a planet where people come to be challenged and to grow in experience?
Absolutely. And I think just looking outside the window or turning the TV on, 5 seconds of the news tells us that it is a planet. And I know that we use in Spiritism, we use the word, the term trials and tribulations, which I think it's a very negative take on what it is. I would say opportunities to change, because it is a world that offers us many experiences where we are challenged. But being challenged is not a negative thing, it's a positive thing. If you're being challenged, it means you already have some awareness that change can be achieved, and now you have the choice to choose better this time around.
Yes. It's interesting, really. Okay, well, that looks like it's the end of the questions. So let's just have a look and see what the time is. Oh, yes, it is indeed end of question time. So, Tania, thank you so much for your presentation, and thank you very much indeed for being so open and so helpful with your own personal journey through mediumship and what you have been able to do with your patients. It's enormously helpful and edifying for us. So thank you very much indeed, and thank you for coming along.
Thank you.
Okay, bye-bye.
Bye.